Hello, my name is Rachel Kelly, and my topic for my Teach Me Something for respiratory this week is bronchiolitis. So bronchiolitis is an acute viral inflammation of the lower respiratory tract involving the bronchioles and the alveoli. If you're familiar with the lung, this is my drawing. So we have our lungs here, with the trachea, we have our bronchi, which go into our bronchioles, and then also attached to those we have our alveoli. So this is a picture of alveoli. What happens in bronchiolitis is that the bronchioles become obstructed by thick mucus, and this is depicted here. This is a picture of the bronchi filled with mucus. They are inflamed as well, and as a result of this, it causes mucosal edema, and it's an obstruction. So that can interfere with gas exchange, and it can lead to hypoxemia, hypercapnia, and also lead to eventually respiratory acidosis. So for this, when you're assessing a patient with bronchiolitis, you're going to find diminished or absent breath sounds, crackles, wheezing, rhonchi, a non-productive or productive hacking cough. This is going to be part of your assessment. Changes in the respiratory rate and depth, dyspnea, tachypnea, fever, and you can also have an increase in mucus and nasal discharge. So this can affect not only your respiratory, your lungs, but also your nose as well. Your nursing diagnoses for bronchiolitis are ineffective airway clearance, ineffective breathing pattern, anxiety and fatigue as a result of these things, and also deficient knowledge, which can be a problem for the recovery also. So we have our image here. Now, how do we intervene with a patient that's experienced this? So firstly, you're going to assess the airway for patency. This is obviously the ABCs number one. We're also going to assess respiratory. We're going to assess breath sounds via auscultation. You're going to assess the cough. And when you're assessing cough, you're assessing frequency, whether you're able to cough up the mucus, consistency of that mucus, onset duration, and also the nasal stuffiness, swelling, and if they're swallowing any of the secretions, because that could affect you as well. You're going to provide rest periods for your patient. You're going to reposition your patient every 2 hours. Going to keep the bed at 30 degrees. And you're also going to assist them in deep breathing exercises. You're also going to make sure they take and finish their medication. So this is often caused by a virus, bronchiolitis. So you're going to educate them also on using the inhalers. You want to make sure their parents are comfortable using them as well. The goal outcome for bronchiolitis is to regain an effective breathing pattern, no anxiety or fatigue, and to have sufficient knowledge so as to recover from this virus. Well, I hope you enjoyed my brief Teach Me Something. This will be attached below for further viewing. And thank you for your time.